Now, I would like to acknowledge our guests and participants for this afternoon's activity. We have, of course, our NYCC President, Marla May Baez, our National President, Mrs. Lilia A. Pereñas, will be joining us later. Dr. Early G. Datario, Vice President for Program and Membership. Ms. Claudine Dapat na po, our Secretary. Ms. Sanibet Gracela, Treasurer of the National Council. Our Public Relations Officer, Ms. Melody Marfil. And of course, we have National Council member Jessica De Boton. We're so fortunate that we have also our immediate past National President, Dr. Baby Ortiz. We have the Secretary of the National Council of Women of the Philippines, Dr. Babes De Leon. The Global and Local Affairs Committee, headed by the chairperson, Ms. Remedios Bicomong, with her members, Ms. Elizabeth Diaz, also the president of YWCA of Makati. We also have Ms. Rachel De La Cruz, a member of the Global and Local Affairs Committee, and also from Amara Counseling and Training Center. And we have Marcia Bicomong, who is with us, also a member of the Global and Local Affairs Committee. We would like also to acknowledge the YWCA Homes, Safe, Attainable, and Educational Project Team who are with us and helping us in the technical side of this activity. We have participants from various areas in the country, from Luzon to Mindanao. We have from Zamboanga, from Baguio, and so many from DepEd. We have from the Department of Budget and Management. We have several universities, we have nurses, doctors, and psychologists who are with us in this afternoon's forum. Thank you so much for gracing this occasion, and thank you for your intent to really learn more about this topic, the Philippine Mental Health Law. As we go on with our activity for this afternoon, please feel free to put your question, comments, when you're sa chat box po, you can give your questions so that later we will have a very fruitful discussion with our resource person. So with that, I would be calling on our National President, Mrs. Lilia A. Pereñas, for an inspirational message.
Beautiful and blessed afternoon to all warriors. Magandang hapon po sa ating lahat. I would like to first of all express my warmest welcome to each and every one of our participants. Welcome to our YWCA online forum regarding mental health. And before anything else, I would like to acknowledge and thank Dr. Early Datario, our Vice President for Program and Membership, YWCA of the Philippines, to Ms. Marla May Baez for hosting this program, to Ms. Nina Haro for the beautiful opening prayer, and to our beautiful and very active National Executive Director, Madam Nerissa Liena. Thank you and congratulations for all your efforts. To our to Mrs. Remedios Bicomong, Chairperson of the Global and Local Affairs Committee, and to our guests for this afternoon, Attorney J.B. Rosel Gayona, who will be discussing our topic for today, which is Understanding Mental Health Act number 11036. She is a past NYCC President and Head Legal Counsel of Calavera Technologies Private Limited Incorporated. And the members of the project team for the World YWCA COVID response entitled YWCA, a home which is secure, attainable, faith-based, and education. Our warmest welcome again and our most profound gratitude for gracing our humble forum. Mabuhay po kayo. I cannot emphasize enough how important our topic today is. But mental health has taken its toll on so many people today, especially so because of the pandemic. Not one is spared from being isolated into the confines of their homes. People just can't go out like they used to be, and almost the whole of our populace utilize the internet and the television as the primary window to view the outside world. Sadly, our present world is not painted in beautiful colors, much as we like it to be, but rather it is a sight painted in drab gray that is sad, lonely, depressing, and almost dying. It is a picture where death is looming in the distance. From January to August, the total number of deaths by suicide in Baguio City alone has reached 18.14, of which occurred during March to August. What is surprising is that this particular statistics is more than the deaths caused by COVID-19, which is 10. And according to the head of the City Epidemiological and Surveillance Unit of the City Health Services Office, Dr. Donabel Tubera, suicide cases are still yet to be expected to increase. Another data from the Department of Health, Cordillera Administrative Region, reported that from January to June of this year, there were 51 suicide attempts in Baguio alone. Their ages ranged from as young as 13 years old and as old as 70 years old. 37 of them are women and 15 were men, which gives us the central reason for conducting this forum. Friends and fellow warriors, as women leaders, we are once again challenged to see how we can curb this sad truth, especially so because the date shows that it is women who are mostly targeted by this monstrous atrocity. We cannot allow our sisters as well as our brothers to die in such an unreasonable and vain manner by their own hands just because we fail to understand their situations and what they are going through. The YWCA movement have been very strong in advocating for women empowerment and promoting women's welfare, including mental health, due to its mission of developing the mind, the body, and the spirit. The World Health Organization statistics as of October 2019 shows that 1 in 4 people in the world will be affected by mental or neurological disorders at some point in their lives. Around 450 million people currently suffer from such conditions, placing mental disorders among their leading causes of ill health and disability worldwide. In the Philippines, the data is not far from the global situation. It is 1 in 5 people suffers from a mental health problem. You might see this as not high, but in a country with a population of over 100 million Filipinos and with only 700 psychiatrists and over 1,000 psychiatric nurses, this is one major concern. Between 17 to 20% of Filipino adults experience psychiatric disorders, while 10% of Filipino children ages 5 to 15 suffer from mental health problems. According to the National Statistics Office, mental health illnesses are the 3rd most common forms of morbidity for Filipinos. Furthermore, a 2010 national census that found 1.4 million people with identified disabilities showed that mental disability accounts for 14% of all disabilities. In the same NSO study, 88 cases of mental health problems were reported for every 100,000 Filipinos. According to the latest numbers from the new Philippine Health Information System of Mental Health, schizophrenia is the top mental health problem in the Philippines, affecting 42% of the study cohort. Most of them were male. There are many factors that affects our mental health. But I believe that to the experts to discuss and give you more information. Our country has passed the law after more than a year. What has been done? Did the law created a dent in addressing the issue? With the onset of COVID-19 pandemic, one of the aspects of human life that is greatly affected is our mental health. Thus, the YWCA is holding this Y Talk series for us to have better understanding of these issues. Let me close with a quote from the Bible about man being a tripartite creation. In 1 Thessalonians chapter 5 verse 23 states that we were all created with three basic parts: a spirit, a soul, and a body. Now, may the God of peace himself sanctify you completely, and may your whole spirit and soul and body be kept blameless at the coming of our Lord Jesus Christ. Even as Christians, you'll have a good days and you'll have bad days, but you'll never have a day without God. So we rest in this blessed assurance. And so, let us now listen to our speakers, and hopefully we can concoct, we can create, we can devise, and prepare solutions to this social menace that seems to be even more deadly than the pandemic itself. Thank you for your participation, and please voice out your sentiments and your ideas on how we could tackle this problem. Before ending, I have some questions and concerns. As YWCA members, how can we contribute to at least slowing down the onset of depression, which is the major cause of suicide? Second, how can we reach out to people, especially women, in order to understand what they are going through? And the last one, how can we identify people who are depressed or those who are thinking about suicide? Maraming salamat at mabuhay po tayong lahat. Good day, and please stay safe, everyone. Thank you.
Thank you, President Leia. Indeed, as Chris, we can have good days, we can have bad days. But rest assured that every day we have our Lord Jesus Christ. So with that, I will proceed with introduction of our guest resource person, but I would like also to acknowledge her presence right now in our Zoom, Attorney J.B. Goyona, and of course, the moderator, Professor Dan Yema. So to introduce our resource person, Attorney J.B. Rosel Gopo Gayona is a close friend of mine. I consider her my younger sister. Kaya naman ang request niya na iklian ko lang ang aking introduction sa kanya. Mabait naman siya, so I will abide. Attorney Gayona is currently the head legal counsel of Colabera Technologies Private Limited, one of the pioneering technology company which has over 2,500 employees, and their base is in Cebu and Manila. She is a graduate from San Beda College, Bachelor's of Law, and admitted to the legal profession in 2007. She is also a licensed and certified human resource professional and a licensed safety officer too, other known as BOSSH. As company's head legal counsel, she handled 4 areas of operation. Number 1, legal, which includes contract review. Second is compliances, DOLE compliances and Securities and Exchange Commission. Human resource for internal employees, and employees relation, employees deployed at client site. In her personal capacity, JB, as we fondly call her, is currently a member of the Legal and Ethics Committee of the YWCA of the Philippines and the Disaster Management Committee. She holds a distinction as the first young woman to hold the vice president position in the YWCA of the Philippines, which is a member association of the World YWCA based in Geneva, Switzerland. She was first elected as NYCC president, which earned her a seat in the National Council, the highest policy-making body of the organization, where in her first term, she was elected treasurer of the National Council and later on as the vice president for program and membership. Ladies and gentlemen, may I now present you Attorney J.B. Rosel Goco Gayona.
So, good afternoon, everyone. I am very honored to be part of this YWCA initiative on this lecture series seminar. So, this afternoon, we have a very interesting topic today, the Philippine Mental Health Act. So, before I proceed, I'd just like to ask the cooperation of everyone to give full attention to the topic because later on you can ask questions after the discussion of our part 1. So, with limited time and without further ado, let's begin. So the Philippine Mental Health Act, Republic Act number 11036. So this bill was passed by the Congress back in 2017. However, it was signed into law on June 21, 2018. In appreciating the beauty of the law and give clarity to its implementation, we must also look into the reason why, bakit nag-create ang Congress ng ganitong batas. Actually, as early as 2001, we have the Philippine National Mental Health Policy already. Pero policy pa lang siya. So, over decades, through the monitoring ng census, there is a growing number of individuals who have concerns in mental health. So, likewise, Philippines is a signatory to the United Nations resolution, yung principles for the protection of persons with mental illness and for improvement of mental health care. So, with that, we have now this Philippine Mental Health Act. So why did the Congress enact this law? What are the objectives? So first is to strengthen the effective leadership and governance for mental health, to establish a comprehensive, integrated, effective, and efficient national mental health care system responsive to the needs of the Filipino. Third, to protect the rights and freedom of persons with psychiatric, neurologic, and psychosocial needs. To integrate mental health care in the basic health services, integrate strategies promoting mental health in educational institutions, workplace, and in communities. So as we go along in the discussion, we will see if the law and its implementing rules indeed achieved its objective. Okay? So, kanina pa tayo nagbabanggit ng mental health. But, do we really know the concept of mental health and how is it defined in the implementing rules ng Philippine Mental Health Act? So, what is mental health? This definition, ito yung pagkakadefine ng ating mambabatas sa mental health. So, sabi dito, It is the state of well-being in which individual realizes one's own abilities and potentials, copes adequately with the normal stress of life. So ibig sabihin, it involves a coping mechanism, no? Displays resilience in the face of extreme life events. Sabi, magpakatatag tayo o magpaka-strong during extreme events sa buhay natin. So works productively and fruitfully and is able to make a positive contribution to the community. So based on the information or the definition provided, sa palagay ko, masyadong malawak yung scope and mabigat yung expectation sa usapin ng mental health. Especially the last three aspects. Yung resilience, to be productive, and yung may positive contribution to the community. Siguro later, we can confirm the same or ask our psychologist what is her take on the definition of mental health. No? So, the IRR is lengthy. Sobrang haba niya. So since we have two parts of this series, dinivide ko siya into 4 areas. And for today, we will cover the first 2. So, 4 areas covered, yung rights ng service user, family members, legal representatives, medical professionals. Second part, this is about the informed consent. Third part, services available. And fourth is the duties, role of the government. No? So, uh, for part 1, we'll tackle first rights and informed consent, although in passing, we'll be able to generally discuss some parts ng services available and role of the government. So, for easier understanding, siguro mas mabuti na kilalanin muna natin sino yung mga bida sa usapin na to, di ba? Para sa K-drama. Sino yung mga character sa kwento, sino yung bida dito sa Philippine Mental Health Act. So, rights of a service user. Pero sino ba yung service user? Who is a service user? So, a person with lived experience of any mental health condition, including persons who require or are undergoing psychiatric, neurologic, and psychosocial care. Let's try to have an overview of the terms mentioned for purposes of discussion. But of course, our medical professionals will be able to explain more, no? So when we say psychiatric, what is this concept? So this is usually diagnosed by a mental health professional when a person has a mental illness that greatly affects their thinking, mood, and behavior. So examples, yung detachment from reality or yung tinatawag na delusion, paranoia, yung belief that others are out to get you, and hallucination, yung seeing things that are not existing, so seeing things that are not there. How about neurologic? So, this is a condition affecting the nerves and the nervous system. So, yung example, yung mga nakaka-experience ng seizure, may unexplained pain, may decreased alertness, and may panic disorder. And yung last aspect will be the psychosocial. So this is a condition or illness caused or influenced by life experiences, social factors, like depression, anxiety, coping skills. No? So basically, this is our reaction to what is happening around us. So what is usually, so ito yung definition natin ng service user. But what are the rights? Ano yung mga karapatan ng service user? No? So, number 1 is freedom from all forms of discrimination and stigmatization. So, what does this mean? If we know someone who is undergoing a treatment or counseling, we do not alienate them or yung tipong i-deny natin sila ng opportunity because of that. And then later on, even if, for example, naka-recover na for depression, tapos na siya mag-treatment, But yung may branding ka na dun sa tao. For example, si Maria, ganyan yan eh. Yung stigmatization, nakatatak na sa kanya na yung, yung si Maria may problema yan sa pag-iisip. Kahit during that time, healed naman or cured naman na tapos na si Maria dun sa phase na yun ng buhay niya. So yun yung freedom from all forms of discrimination and stigmatization. And then second, to exercise all their inherent rights. Yung political, makaboto, economic, makapagtrabaho, religious, yung makapag-exercise ng belief, yung makapag-aral, educational. No? Kasama rin sa rights ng isang service user is to have access to the following. So, quality and standard evidence-based treatment, access to affordable essential health and social services, and access to mental health services at all levels of national healthcare system. So, tanong natin, sa ngayon, affordable ba? No? So, PhilHealth coverage kasi it's only limited to psychiatric conditions requiring admission, and the guidelines of PhilHealth is from way back 2010 through their PhilHealth Circular Number 09 Series of 2010. PhilHealth only covers hospitalization brought about by acute attacks of mental and behavioral disorders. For HMO providers naman, unfortunately, since they are private arrangements, hindi lahat ng HMO nagko-cover nito. So, like sa amin in Telecare, wala pa siya sa existing package namin, or if may include man as per our negotiation, it will add up sa premium. So the offer we got is, I think, additional 400 pesos sa premium, but that additional 400 pesos will only entitle the HMO holder for 30 minutes phone session. So 400 pesos, 30 minutes phone session. So with that, we are still looking for more options. Sabi rin, isa sa mga karapatan is to have an access to mental health care services at all levels of national healthcare system. So ayon sa implementing rules and regulation, there will be mental health services at the community level. So sa city, municipality, barangay levels. Likewise, there will also be community healthcare facilities in provinces, cities, clusters of municipalities. What are the examples? No? Ano yung ipuput up sa community healthcare facilities? So, outpatient care centers, halfway houses, crisis centers, usually with adequate room facility, for mental health care workers, magkakaroon din ng yung volunteer members, and siguro magdadagdag sila ng barangay health workers. However, as we speak, I think this is a long way to go, no? Because in the IRR of the Department of Health, ang nakalagay is they will develop guidelines, and this will be in collaboration with the local government units din. So with the way things are happening now, that I know COVID is our primary concern, and I think LGUs, even barangays, with their manpower and resources, hindi pa capable to cater into these healthcare facilities na ito. No? So with this, I think this baby steps until the completion of these plans and programs. Kasi itong namang Philippine Mental Health Act, this is more on a right-based approach, meaning nililinya mo na yung basis, yung mga karapatan. Ano ba sa palagay mo yung mga karapatan na ayon dun sa mga nabanggit natin, yung service user, legal representatives, mental health care workers, so yung mga bida sa Philippine Mental Health Act. Sabi dito, dapat daw meron ding access yung service user sa comprehensive and coordinated treatment, integrating holistic approach and user-driven treatment and recovery plan. So this also involves treatment in a less restrictive environment and manner. Yung right niya to humane treatment, free from torture, degrading treatment and procedure. So yung nakikita nyo sa mga drama na kinukuryente, yung pinapahirapan. So bawal yun, no? Then they're also entitled to an aftercare and rehabilitation in the community. So once matapos na yung treatment, dapat makatanggap din sila ng support from the community how to integrate them back into the society. Kaya sinasabi ng batas na bawal ang discrimination, bawal ang stigmatization, because later on, once makomplete nila yung treatment, karapatan din nila yung social integration na makabalik dun sa dati nilang community na ginagalawan ng walang discrimination, walang stigmatization, that they can live a normal life din. So kasama pa rin sa rights ng service user yung na mag-participate sa mental health advocacy, policy planning, research, and legislation. And confidentiality. So in all forms and medium of all information, communication, yung records, yung treatment, or any aspect of the service user's mental health. Meaning, this is secret. This is covered by the Data Privacy Act. This cannot be disclosed. Meron lang mga instances when it can be disclosed, but the general rule is that all forms and in all mediums, lahat ng information, communication, records at treatment dapat manatiling confidential. So, sabi ko nga, that is the general rule. So, what is or what are the exceptions to this, no? Silipin natin. So, when can we disclose the information and records of a service user? So, una, when there is a written consent of service user or legal representative. And then, second, when disclosure is required by law or by virtue of a court order. And in cases of a life-threatening emergency, and yung disclosure is necessary to prevent injury or harm. Pwede ring i-disclose yung information and records if, for example, si service user is a minor and yung attending mental health professional believes that the service user is a victim of child abuse. And lastly, disclosure is required in connection with a case against mental health professional for negligence or breach of professional ethics. So to continue with the rights of a service user, they also have the right to give informed consent and withdraw said consent. To appoint a person of legal age to act as their legal representative, to send or receive uncensored private communication from the Commission on Human Rights. So later on, we will have a detailed discussion on this informed consent and appointment of legal representative, as well as the communication na tinutukoy dito and ano yung involvement ng Commission on Human Rights. Yung service user, meron din siyang karapatan to legal services. Meron siyang karapatan to be informed within 24 hours upon admission sa isang mental health facility ng mga karapatan, yung mga diniscuss natin, no? And meron din siyang right to file complaint. Siguro tong right to file complaint, we will elaborate as well in part 2 of the discussion, because this is a sensitive topic and sometimes may halong technicality. So we will elaborate on that. Mas mabuti yung we know first the basic concepts the main point or yung focus ng discussion ng Philippine Mental Health Act, which yung mga taong involved dito, yung mga reason bakit meron tayong Philippine Mental Health Act ngayon. So, in passing, so what can be the subject of complaints? So, yung impropriety or abuses sa mental health care or violation of rights of persons with mental health needs, and illegal or unlawful involuntary treatment or confinement. But the subject of the complaints, I believe it's not limited to those in the IRR. I think there are more violations na pwede mong sampahan ng reklamo, but it may not fall under the Philippine Mental Health Act. Pwedeng sa Revised Penal Code, pwede rin yan sa violation ng Labor Code. Later on, yung sa introduction ng mental health care sa workplace or sa school. So, depende, no? But at least dito nire-reinforce yung karapatan nila, and later on i-assert yung right na yon sa proper forum, meaning the court of law. Diba? So initially yun yung mga rights ng ng service user, no? So siguro with that, before we proceed dun sa rights ng family members, carers, legal representative, so let's take a short break. Okay?
Okay, we have a short break for now. So the World YWCA, where the YWCA of the Philippines is a member association, has a program for safe space for young women and women of various ages and sexual orientation. We shall present to you the reason why the YWCA of the Philippines is very strong in its advocacy on creating a safe space for women and girls. Let's watch this.
As part of a movement that has more than 150 years of experience working directly with women and girls, the association aligned its program and activities with World YWCA's strategic goals to ensure that young women and girls are at the center of the program. For the past 150 years, YWCA's have expanded safe spaces to reach over 25 million women, young women and girls in 120 countries. Providing safe spaces to women and girls in the heart of local communities has been a core activity for the YWCA since its founding in 1855 in London in 1926 in the Philippines. YWCA is also committed to programs on social and economic justice through action and advocacy and service delivery. YWCA is also committed to programs. What makes the YWCA unique is that our program and services are combined with our advocacy to create impact in young women and girls' lives and generate institutional change. Accessible and safe location. The YWCA National Headquarters is very visible and accessible. It is located in the heart of Metro Manila and provides shelter to young women and girls where safety and privacy are assured. Leadership and participation. The YWCA is committed to empower young women and girls by providing trainings, seminars, and the like to fully equip them in decision making and bring positive changes in the community. Leadership development and participation opportunities will provide them a chance to equip themselves essential skills and positive transformation.
what's very important for Christians to understand is it's not a question of you not praying or not praying enough. This is an actual sickness, and I want you to understand that you are not being punished by God.
Building trust. YWCA is open for every woman, young women, and girls to fulfill the association goal to develop women as a leader and members in body, mind, and spirit. YWCA have been initiating programs and activities to help boost self-esteem with physical, social, intellectual, moral, and spiritual well-being of women and girls in accordance with the Christian ideals. Furthermore, to build the confidence of the member, any sensitive cases or information are confidential in the association. Holistic approach. YWCA have been providing support to women, young women and girls, not just in mental and social being, but also their physical, emotional, and most especially spiritual well-being. Also, the organization integrating Christian values in all programs and activities. And one of these examples is Bible class. It has a huge impact to support leaders and members to engage in selfless Christian service and to use the new knowledge to educate more young people. Intergenerational cooperation. National YWCA prepare and develop women seminars, conferences, and meetings for decision-making groups to participation in all aspects of social, economic, political, and spiritual life. And this is to build and strengthen the institutional capacity of the movement. In line with the World YWCA, the National YWCA had policy-making vested on 17 members, with 25% young women in National Council headed by the President. Dignity and respect. National YWCA provides opportunities to young women leaders to involve and participate themselves to develop their knowledge, attitude, and skills in leadership and issues affecting them. Partnership and accountability. The National YWCA is linked with hundreds of countries around the world through World YWCA, whose headquarters is in Geneva, Switzerland. YWCA have a partnership with other organizations like RSA, GSP, BSP, NCWP, Renewable Energy Coalition, PhilCADSA, DepEd, and Power Philippines, to name a few. This is to extend the scope of the mission and vision of the organization to achieve with the same goals.
We will cheer and on our team.
you. And now we shall continue with our presentation of Attorney JB. Are we ready with the PowerPoint? Okay, as we prepare the PowerPoint, as you could see, the video that was presented to you are the different activities under the Safe Space program of the YWCA of the Philippines. This activity is also part of the World YWCA COVID-19 response project, wherein the YWCA of the Philippines was recognized for its various activities, and we are encouraged to really do more activities like this, especially to help our young women and girls who are badly affected by this COVID-19. Imagine cutting the schools. They don't have something to do at home. Our seniors who are prevented from going out for safety reasons. So this is one way of encouraging them to participate in different programs. And that includes the kids. We just conducted the Zoom Bible class a week ago prior to this activity. And we have more than 40 plus participants who attended the Zoom Bible class coming from different areas where YWCA exists. The farthest is from Iloilo. You could see the pictures there of young children in a camp. This is a campsite where they were allowed to join the Zoom Bible class. And we have volunteers, teachers who undertakes this Zoom Bible class. So they were also prepared to go online schooling by the opening of classes because they were rehearsed in doing Zoom Bible class. So I think our technical is ready with our PowerPoint. Earlier, you have some questions already posted in the Zoom chat. Please feel free to post your questions. If we were not able to answer your question later, don't worry, we have part 2 by next week. The part 2 of this understanding mental health law will be happening Wednesday next week, September 30. On Friday, there would be a discussion on the mental health, and we will have psychologists who will be our resource person. Ito na po yung mga iba-ibang concerns natin on our mental health. And we will be posting some of the link to you so you can register for part 2 and for the Friday activity. So I think we're ready.
So let's continue after our short break. So we are on the topic already of the rights of family members, caterers, legal representatives. So who is a caterer? So a person who may or may not be the patient's next of kin or relative, who maintains a close personal relationship and manifests concern for the welfare of the patient. Meaning, a caterer, pwedeng hindi ka mag-anak ng ating pasyente o ng service user as long as they have close personal relationship and genuinely meron siyang concern doon sa welfare o kalagayan ng ating pasyente. Ano? Now, who is a legal representative? So, as defined, a person designated by the service user, appointed by competent court, someone authorized by this act or other applicable law to act on service users' behalf, or a person appointed in writing through an advance directive. So dito sa legal representative, maraming binanggit na technical terms like advance directive, who are those appointed by the competent court, and why do we need to have the appointment in writing. So later on, we will discuss it further. Okay? So ano yung mga functions ng isang legal representative? Number one, to provide support and help, represent the interest of the service user, receive medical information. They also have the function to act as a substitute decision maker when there is a temporary impairment of decision-making capacity. When we say temporary impairment of decision-making capacity, this is a medically determined inability on the part of the service user or any other person affected by medical health condition to give or provide informed consent. No, this usually happens when for example, the service user is unable to understand information concerning the nature of mental health condition, unable to understand yung consequences of making decisions and actions on one's life or health, and unable to understand yung nature ng treatment. At the same time, kung hindi niya rin kayang i-effectively communicate yung consent niya dun sa treatment. So, the legal representative can act as the substitute decision maker. Likewise, they also function to assist the service user vis-a-vis the exercise of right. They also have the function na in case of consultation relative to the treatment, iko-consulta rin sa kanila, no? So, legal representative can, if for example, you are appointed as a legal representative, can you decline an appointment? So, yes, you can decline an appointment. However, you must inform the service user and the attending mental health professional. If, for example, you've been previously appointed, may naging misunderstanding kayo ng service user or may mga bagay na hindi mo nagampanan as legal representative, pwede ka bang palitan as legal representative? So, can you be replaced? So, yes, when there is a new appointment or a notarized revocation. Meaning, nag-appoint ng bago or naggawa ng kasulatan, pinanotaryo, na nakalagay sa kasulatan na yun, nire-revoke niya yung appointment mo as legal representative. Now, kung yung legal representative, merong mga functions, dapat meron din silang karapatan, di ba? To empower them to perform those functions as we enumerated. So what are the rights? Number one, to receive appropriate psychosocial support from relevant government agencies. Number two, so with the consent of the service user to participate in the formulation and implementation ng service users' individualized treatment plan. Number three, yung karapatan nila to apply for release and the transfer of service user from one mental facility to a more appropriate mental health facility. Fourth, they also have the right to participate in mental health advocacy legislation. So, pwede silang konsultahin or to be part of, for example, of a technical working group for monitoring, for research, and evaluation. What happens if, for example, there is no legal representative appointed? So the following persons shall act as legal representative in the order provided below. Meaning, sa pagkakasunod-sunod na yan, hindi pwedeng mauna yung number 1 sa number, hindi pwedeng mauna yung number 2 sa number 1. So ano yung particular order? No? So the following person shall act as legal representative in the order provided below. So number 1, si spouse, yung asawa, unless permanently separated na sila ng ating service user by court decree or such spouse has been abandoned or inabandon na niya o inabandon na siya noong service user. So, number one, yung spouse, ano? So, unless, yun nga, yung exception natin, kung permanently separated na by court decree. Pangalawa, kung hindi man by court decree, if inabandon siya or inabandon niya yung service user, hindi pwede or hindi qualified yung spouse. Kung hindi qualified yung spouse, ang pwedeng maging qualified is yung non-minor children, meaning 18 years old pataas na anak noong service user. If yung spouse at yung non-minor children hindi rin pwede or hindi available, hindi capable, yung pangatlo sa listahan natin is either parent by mutual consent if the service user is a minor. Pero kung hindi minor, magpo-proceed tayo doon sa number 4, yung chief, administrator, or medical director of a mental health care facility. Kung hindi yung administrator ng mental health care facility, a person appointed by the court. So, in that particular order. So, sa spouse, either parent by mutual consent kung sakaling minor, yung chief, administrator, or medical director of mental health care facility, person appointed by the court. So, yun yung pagkakasunod-sunod niya. Spouse, non-minor children, either parent by mutual consent, chief administrator ng mental health care facility, person appointed by the court. Now, what are the rights of the mental health professionals? Pero sino-sino ba yung kino-consider natin as mental health professionals? So, they are the medical doctor, psychologist, nurse, social worker, guidance counselor, or any other appropriately trained and qualified person with specific skills relevant to the provision of mental health services. Now, ano yung kanilang mga karapatan, no? One is to have a safe and supportive environment. Meron din silang karapatan to participate in continuous professional development program, development and management of mental health services, development of mental health policy and guidelines. They also have the right to contribute to the development and regular review of standards for evaluating mental health services provided to service users. Except in emergency situation, no, they also have the right to manage and control all aspects of their practice, whether or not to decline a service user for treatment. For example, their schedule or the volume of patients hindi na kayang i-handle, pwedeng mag-decline yung ating mental health professional to attend to that service user. But of course, magpo-provide naman yan o magre-refer yan ng alternative kung saan or kung sino yung pwedeng mag-treat sa ating service user. And lastly, mental health professionals, they also have the right to be an advocate ng rights ng ating service user in case, for example, yung service user's wishes are at odds or hindi iba doon sa kagustuhan ng kanyang pamilya o ng legal representative. And for example, if that will be for the benefit or for the welfare ng ating service user, of course, mas bibigyan ng weight yung advocacy or yung karapatan ng ating mental health professional na makabuti para sa ating service user. So kanina nabanggit natin na yung right to provide informed consent. Ano ba yung informed consent? Bakit hindi lang sinabing consent? Meron talaga siya informed consent, no? So we mentioned this one as one of the rights of our service user. And as promised, no, we will elaborate on this. So as a general rule, service users must give informed consent in writing prior to the treatment by health professionals, by the workers, and other service providers of any plan or program of therapy or treatment. Now, what are the guiding principles on informed consent? Um, Number one, it must be voluntary. Meaning, walang sapilitan, dapat kusang loob, walang force or manipulation. Competency, ibig sabihin, naiintindihan ng service user yung information about the decision na kanyang gagawin and may capacity to communicate the decision. Number three, disclosure, meaning yung pinaliwanag, pinagbigay alam ng service provider doon sa service user ano yung magiging treatment, yung consequences ng treatment. Basically, yung concept nito, when you give consent, you have full understanding kung ano yung bagay na pinapahintulutan mo. So, yung disclosure, no? Number four, dapat meron ding understanding. And lastly, the decision itself. Yung decision ng service user authorizing and allowing mental health professionals to execute the proposed treatment plan. Now, this informed consent, meron din siyang exception. Kailan yung hindi nag-a-apply itong informed consent? So, it does not apply during psychiatric or neurologic emergencies or may impairment or temporary loss of decision-making capacity on the part ng ating service user. Pag nag-apply itong dalawang exception na to, there are guidelines or limits naman na provide yung IRR o yung batas to safeguard the condition and the welfare of our service user. So, in the absence of an informed consent, so if the situation fell into the exceptions, the treatment, confinement, or restraint shall be administered under the following safeguards. Number one, it must be in compliance to the service user's directives. So if it is applicable. Number two, only up to the extent that the treatment or restraint is necessary and only while the psychiatric or neurologic emergency or impairment or temporary loss of capacity exists. So, yan yung mga safeguards, yung mga limits, no? In addition to that, it must be upon the order of service users attending mental health professional. If, for example, nagbigay ng instruction or order or treatment plan, yung mental health professional, that order must likewise be reviewed every 15 days. Kung naangko pa ba, nagbe-benefit ba, may improvement ba doon sa ating service user. So, involuntary treatment is in strict accordance with the guidelines approved by appropriate authorities. So, dapat may clear criteria as to the regulation ng application and termination of the medical intervention. Dapat din it's fully documented and subject to regular external independent monitoring by the Internal Review Board. Ano yung concept ng advance directive? So, in relation to informed consent, advance directive must be signed, dated, and notarized. It may be revoked by a new advance directive or by a notarized revocation. So, ang tanong dito, and emphasis natin, that's why it's nakakapitalize. So, in cases of advance directive, it must be signed, pirmado, dated, and notarized. Bakit kailangang signed? Of course, pinapakita na talagang yung service user yung nag-authorize o nag-agree doon, yung nagbigay ng consent. Dated, mahalaga yung dated kasi yung condition ng service user during the time that the advance directive or the informed consent was given, ibig sabihin maayos, walang impairment. So, material yung date. For example, na-predict niya or na-foresee niya that a certain condition will happen or yung condition niya will worsen. For example, as early as January, nag-execute na siya ng informed consent. So, yung date, malaking bagay to determine kung genuine yung informed consent na ibinigay ng service user. And of course, bakit kailangan notarized? Ibig sabihin, yung document na naglalaman ng informed consent, totoo, at yung pirma niya, genuine, na yung service user mismo yung pumirma. Kasi kapag notarized document, ina-affirm ng notary public na siya mismo magpapatotoo na totoo and genuine yung dokumento. Okay? So, sabi nga natin parang nung sa simula ng discussion that kailangan kilala natin who are the characters dito sa Philippine Mental Health Act. Sino yung ating mga bida, no? Main characters. Pero gaya ng kahit anong usapin or yung mga story or mga na importante na merong mga supporting roles din. So, dito, meron tayong concept ng supported decision making. So, a person may designate up to 3 persons or supporters, including yung user's legal representative for purposes ng supported decision making. When we say supported decision making, a person, so yung ating service user, may designate up to 3 persons or supporters, including the service user's legal representative for purposes of supported decision making. Okay? And of course, as a supporter, ano yung magagawa mo? So, as a supporter, meron siyang access to the service user's medical information. Kasi remember, di ba, binanggit natin dapat ang medical information relating to the service user should be confidential. So as a supporter, meron siyang access sa service user's medical information. Meron din siyang right or pwede rin siyang mag-consult with the service user regarding any proposed treatment or therapy kasi iba ang papel niya nga or ang role niya is to provide support during the time ng decision making. So pwede silang mag-confirm, pwede silang magipag discussion and be present during service users appointments and consultations with mental health professionals. So again, sabi nga natin, the treatment plan, it should be kept confidential. So during consultations and appointments sa psychologist or psychiatrist, a supporter can be there for our service user. So those are the three main things that a supporter can do under the IRR. So after knowing the basic concepts, the rights of our service users, mental health professionals, so yung informed consent kanina, sa next part which will happen next week, we can discuss in detail the duties of government agencies as well as the integration of mental health in educational system, and of course yung sa workplace, no, kasi medyo extensive dahil nag-issue na rin ng Department of Labor and Employment ng advisory to be followed sa workplace, and mas maganda siguro if we can discuss it lengthily and thoroughly because I think most of you nag-work na, so yung applicability and kung meron kayong katanungan, I think masasagot din ng labor advisory. So, for the part 2, it will be next week, I think, same time. So, I hope for this session, the part 1, the basic terms and concepts, I hope somehow meron tayong napulot, mayroong agaw kaalaman na pwede nating magamit. No? So, siguro kung meron kayong we can also provide you with a summary later on of the presentation once we've concluded everything na. So again, thank you, and I hope you always stay safe and healthy.
Depression is the largest cause of disability worldwide. At worst, depression can lead to suicide. In humanitarian emergencies, 1 in 5 people are affected by depression and anxiety. Depression and anxiety lead to a global economic loss of $1 trillion per year. On average, just 3% of government health budgets is invested in mental health. Depression can be prevented and treated at relatively low cost. Treatment usually involves talking therapy or antidepressant medication, or both. If you think you have depression, talk to someone you trust. Seek professional help. Depression. Let's talk.
Okay. Sorry for that. Malakas po ang ulan dito sa UN, so may mga internet connection problem kami. Now I will proceed with the open forum, and to serve as our moderator, we would like to call Professor Dan Paulo Yema. But first, let me give you some background of Professor Yema. Professor Yema is a licensed clinical psychologist and certified mental health first aid responder. He graduated with a Master's of Arts degree in psychology, major in clinical psychology at the University of Santo Tomas. Dan, as we call her, currently works as an assistant professor at the University of the Philippines, Los Baños, teaching both in the undergraduate and graduate level. He is also the current chair of the Mental Health and Psychosocial Support Special Interest Group, MHPSS-SIG, of the Psychological Association of the Philippines. Aside from teaching and clinical work, he also conducts trainings, seminars, workshops in mental health and psychosocial support, psychological first aid, self-care, and stress management. He also serves as consultant to HealSpace Psychological Clinic in Lipa City and other government and non-government organizations. Let's welcome Mr. Dan Yema. Nakamute, sir. Nakamute po kayo.
Ayan, okay na po. Sorry. Kailangan po kasi ng permission kanina to unmute. Before anything else, I would like to thank YWCA Philippines for the invitation. And konting update lang po sa binasa niyong information about me. I'm already the outgoing chair of the MHPSS-SIG kasi nagkaroon na po kami ng election. Ayan, hindi na po ako nag-re-elect. So good afternoon po sa ating mga participants, and I'm here together with our resource speakers and also from the YWCA, si Attorney JB kanina and si Miss Neri to address ilan po yung sa mga katanungan na naibigay na sa amin, and you might want to ask also some questions. So feel free to use the chat para po ma-address natin yung ilan sa inyong mga katanungan. Ayan, so again, can I invite Attorney JB and Miss Neri to join me para po sa pagsagot po ng mga katanungan ng ating participants. So I'm going to read some of our mga questions no, na naibigay sa atin. And this first question coming from the OAS Polytechnic School is can be answered by both Attorney JB and Miss Neri from the YWCA. And the question has something to do with how can young ones, adolescents, and women be empowered in the society? So I guess it can be related to our topic this afternoon regarding the mental health law. So, Attorney JB or Miss Neri, sino po ang mauunang sumagot sa atin?
Hi, Sir Dan. Good afternoon. Before I proceed with answering the questions, I would like to again thank YWCA, my YWCA family for inviting me to discuss this topic on Mental Health Act. Were it not for the work from home setup, malamang hindi na naman ako makaka-attend because of the work commitments, but as long as possible and kaya ng time ng walang mahirap humindi sa invitasyon ng YWCA because I started with YWCA back when I was in college, so that was how many decades ago already. Let's hide the age. Let's hide my age. So thank you for that warm introduction, Ma'am Neri, Ate Neri, and of course to my YWCA family. And everyone na nandito who attended this Y Talk series. Gusto ko rin pasalamatan yung boss ko because I was supposed to attend another meeting, but then I told him, boss, I cannot attend as much as I want to because I've already made the commitment to YWCA that I will be giving a talk and I will be answering some questions on mental health. So I hope you understand. And ang sabi naman niya, okay, JB, good luck. Okay, so we're good. So siguro to answer how to empower young women, when you say empower someone, I believe you have to somehow make them feel stronger and more confident, more confident. So first let's create a safe space for them where they can talk freely about their emotions, na walang judgment, walang bias. Sometimes listening to their needs. Not necessarily you're gonna say something, an advice or anything, but I believe it's listening by heart, not just by our ears. So once we know their needs or how they feel, we know how to provide support to them. Example, if there is a need to belong or the need to be acknowledged or the need to feel that, I'm not alone. So there are support groups like what we have in YWCA for, for adults, young women, like the many projects we have in partnership with HealSpace and Amara. And those shown ni Ate Neri kanina by the videos and all. And I believe that knowledge is power. Sabi nga ni, ka-Ernie dati, knowledge is power. So we have support groups. There are available hotlines. And now, itong Philippine Mental Health Act, sabi ko nga, this is a right-driven approach. So, the fact na knowledge is power, yung mga karapatan mo, ano yung mga available na tulong sa'yo, ano yung mga facilities ng gobyerno, be it sa community level, be it sa mga schools, yung pagkakaroon ng mental health policy sa workplace. I think malawak yung support na available. So with that, once you know all those rights, availabilities ng mga bagay na yun, alam mo may makakatulong sa iyo. I believe that's a big step in empowering our young women, our young at heart. So not just young women, basically everyone who's undergoing mental health concern during this time.
Okay. Thank you, Attorney JB. Miss Neri, would you like to add something po about empowering young women?
Okay. Siguro, na-mention naman ni JB yung iba because coming from experience, I too started as a young woman when I was in high school. And I believe that having the opportunity which the YWCA can give you, because sabi nga kanina sa video, di ba, it's an intergenerational approach. In the YWCA, young as teenagers have the right, have the opportunity to speak their minds, give their ideas. And because our mentors are also there, the YWCA leaders have paved the way for us to really express our ideas, show our potentials, and this greatly helps in developing us. we have different kinds of training for young people, as you could see in some of the videos that was presented. The family of YWCA allows you to grow. That's why it's the inverted triangle. You don't stop being a member. You don't stop in as beneficiaries. You go above and become leaders. And YWCA has the legacy of developing leaders. There, in our history, a lot of women leaders in our country has this background about YWCA. So I was so happy looking at the questions earlier. Then there was some expressions from the Gupan, from Urdaneta, Pangasinan, for us to help them organize YWCA in these areas, because in the YWCA, we develop young women to make informed choices, because we believe that informed women makes informed decisions.
Okay, thank you very much, Miss Neri. Now, for our next question, this is something to do with the law. So I guess Attorney JB could answer this question. Now, this question came from SDO. Hindi po ako familiar kung ano yung SDO. Pero yung first part ng question has something to do with regards inquiring, no, whether meron ba daw mga registered cases ng mild to severe na mental health cases in relation to the pandemic. And then the second question is about how the law could be able to help those people, especially stakeholders.
For the number one question, I believe there is. But for the actual data, I'm sorry, I don't have. But based on the welcome remarks by our YWCA president, she mentioned some statistics. So basically, it's an alarming rate that we currently have, especially during this pandemic. But as to the actual numbers, I don't think I can provide you, because, di ba, kahit nga yung COVID numbers, hindi maging maibigay ng DOH na accurate. So, siguro we'll defer to that kung ano man yung actual na numbers given. But for the second part of the question, what can the law do for this Philippine Mental Health Act can do para sa ating mga stakeholders? Una, sabi ko nga, nililay daw niya na yung karapatan. Dati, isa lang siyang policy, meaning pwedeng sundin, pwedeng hindi sundin. Sa Philippine Mental Health Act, may mga karapatan na nilay down, may mga violations na nilay down, na sabi ko, i-discuss natin sa part 2, meron yung right na mag-file ng mga legal complaint. At the same time, kung mapapansin nyo, as mentioned, the services available will be based sa community level. So magkakaroon sa barangay. So this will be in coordination as well sa mga LGU. Sa provincial level, mag-set up sila ng mga mental health care facility, including yung pag-introduce sa curriculum ng mental health care. So this is in partnership with, I think, CHED. No? And of course, yung proactive ngayon, yung sa DOLE, they already came up with the DOLE advisory as to how this mental health care policy or act will be adopted sa mga workplaces. And actually, that DOLE advisory on mental health will be tackled in detail sa part 2 kasi masyadong mahaba. That's why I made it a part 1, part 2 kasi mag-information overload tayo. So, ayun, hindi lang yung service user o hindi lang yung taong may nararamdaman o may concern sa mental health, pati ang ating mental health care professionals. Hindi natin sila pwedeng isang tabi, no? Kasi paano sila mag-aalaga sa ating service user kung sila mismo nangangailangan din ng suporta. Ganun din yung meron din kasi itong provision for budget. So, yung mga mga plano na i-integrate sa community, sa school, sa workplaces, at lahat-lahat, may suporta galing sa Philippine Mental Health Act. Because without the Philippine Mental Health Act, the implementing rules and regulations, I think malaking bagay to that, like for example, nabanggit ko kanina, yung PhilHealth, mababa pa ngayon ng coverage. But looking forward, because now that we are raising awareness. There's already the law. I believe it's already, nasa baby steps tayo. So later on, I believe it will improve kung ano man yung coverage ng PhilHealth for mental health care services.
Okay, thank you, Attorney JB. No, update ko din lang kasi we in the Psychological Association of the Philippines, we have been lobbying. Isa kami sa nagla-lobby din yan regarding yung inclusion ng mental health sa yun nga sa mga insurances or HMO. And so far yung pag-i-include niya ngayon sa mga ganung care packages is still nakabinbin pa rin siya no sa Congress, pero hopefully no kapag medyo nag-back to normal na tayo because of the pandemic, bumalik uli tayo, ibalik uli yung pagdinig doon and hopefully ma-include na siya sa mga health insurances.
Siguro with respect to that, kung yung health insurances, ang meron lang saklaw ng power ng Kongreso, yung ating PhilHealth, or baka i-cover as SSS sickness benefit, baka sakali, no? But with respect to HMO providers, these are private companies kasi. So basically, sabi ko nga, like what I mentioned sa amin, we are under IntelliCare. So payag naman yung aming HMO provider to include counseling session for our employees, provided we pay an extra 400 pesos and that will only entitle us a 30 minutes na phone counseling. So parang sabi ko sa HR manager ko, sabi ko masyadong mataas parang for that. When in fact, there are hotlines available, maraming volunteer groups yung nag-offer ng counseling session na gano'n. And sabi nga natin, we want a holistic approach, a treatment plan. But how can that be a treatment plan kung ang libre lamang is a 30 minutes phone session? So hindi siya responsive to the needs of employees and or kung sino man ang under sa HMO. Kaya siguro that's depende kung anong agreement and how, yung willingness to pay for the extra for that, because I think yung session ngayon mataas din yung rates, no?
Yeah. So coming from your statement, Attorney JB, feeling ko related dyan yung next question natin, no? And I guess as moderator and mental health professional, dito na papasok yung task ko to answer some of the mental health related question. And the third question has something to do with that, yung access, no, to mental health care, no? And this question came from HealSpace, no? Ang question nila, how can we help people care for their mental health when help is not always available and affordable, which I guess is also a very timely issue now, no, during the pandemic. And to answer that question, no, pwede kong hatiin yung answer into two pagdating sa magagawa natin. One is on the personal practical side and the other one is on the organizational side, no? So for the practical side, no, lagi naming sinasabi kami as mental health professionals that one way that we could help people is to always give our time or our undivided attention, no, para sa kanila, makinig sa mga problems nila, no? There is what we call supportive communication, wherein we employ active listening and empathy, no? Maganda yung napapakinggan natin sila, no? Nava-validate natin yung mga experiences nila, because isa po sa mga problema ngayon kung bakit ang mga tao natatakot silang mag-seek ng professional help or humingi ng tulong sa kapwa nila is this feeling of invalidation. No, kunwari lalapit sila sa inyo, no, sasabihin nila or nakakaranas ako ng isang problema, ng isang concern, and then parang iaano lang natin, babaliwalain lang natin yung sinasabi nila, no? Sasabihin, hindi, okay lang yan, itulog mo lang yan, ikain mo lang yan, no? At kapag ginagawa natin yon, nai-invalidate sila. So maganda na na-acknowledge natin yung experience ng mga taong humihingi sa atin ng tulong, na-acknowledge natin ang kanilang mga nararamdaman, and then we give them support. Now the question is, how can we give them support? Now, in basic psychosocial support, there is what we call stop, think, and go. And feeling ko yun yung madali kung maituturo sa inyo on the practical aspect, no, kung paano natin matutulungan yung kapwa natin. Again, stop, think, and go. stop, we invite the person to stop and think of the problem at hand. Isipin niya ano ba yung mga problema niya. At dun sa mga problema na yon, ano ba yung mga bagay na may control siya, ano yung mga bagay na wala siyang control. So, after niyang isipin yon, mag-focus siya dun sa mga bagay na may control siya. So that is for stop. And then for thinking, no, isipin niya kung ito bang problem na ito ay na-encounter na niya before, no? Ano yung mga ways na ginawa niya in order to solve the problem, or ano kaya ang ginagawa ng ibang tao in order to address the problem. Ayan, so maraming options. And then by after 'di ba, after thinking, go naman. So sa go, pipili yung taong yon na tinutulungan nyo ng solutions on how to address the problem, and then encourage the person na kapag hindi nag-work yung isang solution, mag-try uli ng iba pang solution. So bakit ko po ina-advocate itong stop, think, and go na ito? Kasi naniniwala po ako that the best way that we can help others is that if we can enable them to help themselves. Ayan. Kaya napakaganda o na practical yung stop, think, go. Now, on an organizational naman, paano tayo makakatulong to help those who are walang availability or walang resources pagdating sa mental health? Nabanggit kanina ni Attorney JB yung mga hotlines, mga psychosocial support interventions. So kayo po sa YWCA as an organization, actually, you can have yourself trained in mental health and psychosocial support, and also psychological first aid. At kami po sa Psychological Association of the Philippines, isa po yun sa mga ginagawa namin to train people in MHPSS and psychological first aid, because we would like parang magkaroon din po ng parang binababa namin yung tinatawag naming community mental health, kung saan yung mga taong walang access can have access, no, by providing trained professionals na kahit hindi po makapagbigay talaga ng professional mental health na services, at least nakakapagbigay po ng mga pangunang lunas na makakatulong po sa mga komunidad. Ayan. So, ayun po for that question. Yes, Attorney JV, would like to add something?
Yes, actually, kanina when I attended the webinar also, no. So it was emphasized and mentioned by I think Yusek Kukweko of Dole, that apart from the employers there being encouraged to establish that referral system, no, that there exists pala a hotline na in partnership sa National Center for Mental Health. So yung may hotline number, so pag tumawag doon, there are also mental health care professionals available na pwede nilang kausapin. And based dito, ang hotline numbers 0917-899-USAP or 899-8727. And then the landline is 7989-8727. So 7989-USAP. So itong hotline numbers, I believe, yun nga, as mentioned, no, may available na mga mental health professional na pwedeng konsultahin. So kung hindi paano magiging affordable and readily available, kung yun yung concern natin, so meron tayong mga hotline. And I think on a personal level as well, if you know someone undergoing phase in their life na yung may mga concern na ganito, tama yung sabi ni Sir Dan and yung nga natin, sometimes you just have to listen by heart, not listen not for the purpose of replying, sometimes just being there and talagang maramdaman ng tao na kausap mo that they have concern, may malasakit ka sa kanila, and genuinely nararamdaman nila yung care mo para sa kanila. Malaking bagay na yun, because in your personal capacity, you can be the light ng tao na undergoing such phase sa buhay niya, somehow dim phase sa buhay niya.
Okay. Thank you, Attorney JB, for answering about the hotline. Kasi dito sa ating Zoom chat, there is a particular question, no, regarding government hotline numbers, no, na pwede nilang tawagan. So yung pong Facebook page, you can actually visit the Facebook page of the National Center for Mental Health. Meron sila doon yung Hope Line, usap hotline. So marami po kayong makukuhang information sa kanila. And then kami naman po sa PAP, meron din kaming listahan ng mga groups and organization offering free consultation. Probably I can connect with Miss Neri later on, and then I can give yung mga hotlines na yon para you can give to your members. Ayan.
Siguro Sir Dan, once we disseminate the information, the slides, the bullet points, the summary of the Philippine Mental Health Act, we can include sa dulo, no, yung mga reference numbers na to para helpful and they can share as well, no?
Yes,
if I may add, Sir Dan. Yeah.
Yes,
this is the very reason why the YWCA conducted this activity. And as you can see, we have partnered with HealSpace and Amara Counseling because of this concern. There are many organizations that have opened their hotlines, particularly during the pandemic. There's Luna's Collective on the issues of VAUC that is happening during the pandemic. Kanina may nagtanong din about the exact data. In fact, we're part of the United Registered Social Workers. This is a big group of registered social workers from Luzon to Mindanao. We have volunteer social workers who do psychosocial first aid and psychological consultations. So you can really access this. Their Facebook pages are open. So for those who don't want, especially young women who wanted a safe place, and it's difficult for them to access all those things because they are afraid. Probably you can link first with the YWCA of the Philippines and we'll link you to them. I also volunteer being a registered social worker, and we have a lot of local YWCA officers who have volunteered to do consultations online. Kaya nga sabi, even our building or our establishment is a safe haven for young people. So, marami po talaga, from bata to matanda. Iba pa po yung issue ng VAUC during this pandemic. So, the Children's Rights Network probably would come up with the data on child abuse. The Philippine Convention on Women, we just concluded the Safe Space Act Forum about the new law, which we call Bawal ang Bastos. So, nasa Facebook page po yan ng YWC at nasa Facebook page din ng National Council of Women. You can watch it also because may mga rights din po doon na nakakatulong because sometimes yung pambabasto sa mga kababaihan it adds to the mental health issue na nararanasan nila. So I think let's collaborate. We have HealSpace, Amara, and of course sa DOLE, andyan naman si Attorney JB. Then we have networks with the Women Lawyers Association of the Philippines. Ito naman yung mga legal issues related to mental health rights. So I think that's all for my sharing.
Yes, thank you, Miss Neri. Okay, dahil napapag-usapan na rin naman natin no, yung mga services, no? We have a question from the Philippine Nurses Association, and their question is about how is our government addressing the needs of people with mental health problems? Probably ako and Attorney JB can answer this. So unahin ko na ako because right now I am a consultant with DepEd and we are now formulating programs para sa mga, hindi lamang para sa mga estudyante from the elementary to the senior high school, but also programs for teachers. Wherein nako-conduct kami ng psychosocial support services for them. Halimbawa, for our learners, meron kaming regular na Facebook Live, yung tinatawag naming DRRMS Buklatan, which is parang book reading for the elementary, and then arts-based activities for high school. Ito ginagawa to sa Facebook, pero ang alam ko by next month magkakaroon na ng yung DepEd sa IBC 13. Ayan. And then for teachers, and the next week meron din kaming psychological first aid provisions for learners naman. This is nationwide. Ito yung ginagawa namin. The same is true with teachers and DepEd personnel. So yun yung para sa mga ano. And then kasi ito specific to sa ano well yung iba na, for example for CHR kasi involved din ako sa CHR and also for dun sa Philippine Competition Commission. So the same is true, pero for CHR and for Philippine Competition Commission, ano sila, specific doon mismo sa mga employees nila. Yan, probably attorney can add kasi lalong higit yung sa DOLE na provisions for mental health.
Yeah, actually, aside from the one we've mentioned, no, so ano yung mga ginagawa ng gobyerno to help people with mental health needs? Number one, of course, by coming up with this IRR. Sobrang lengthy niya that it tries to cover a lot. And kung mapapansin nyo, in-empower sa IRR ang DOLE, meron din part ang DepEd or ang nagagawin for mental health. But DOLE itself, meron din silang sariling advisory. Meaning, for example, an employee is undergoing treatment. Or for example, an employee will file a leave for, kasi I'm having depression. I'll go, papaano yon? Hindi ako makakapasok, hindi ko ma-perform yung aking trabaho. So may mga guidelines na provide yung DOLE, what will be the action ng HR. So yung ano na yon, nandun sa labor advisory ng DOLE na i-discuss natin next session. But aside from that, na ini-empower niya, i-encourage niya rin yung mga employer na i-develop yung kahit na work from home, magkaroon ng work-life balance. So like in our case, sa opisina namin, merong mga engagement activities online. Merong magpa-TikTok kami, ganyan. Merong kaming e-session, merong app yung they can sing along, yung mga ganon. Tapos may pa-contest na kung ano-ano. So somehow may pa-Zumba online, yung mga ganyan. Malaking kasi kasama rin yun sa initiative ng DOLE na employers make sure na yung mga empleyado nyo may work-life balance, tayo ng psychosocial support, and at the same time mag-establish kayo ng referral system sa National Mental Health Care na sa DOH. So yun. And ako, I believe nasa baby steps, no? Sabi ko nga, there will be involvement ng LGU from the barangay level to the cities hanggang probinsya. Nandyan din yung para sa akin, i-consider ko yung mga provisions ng Bayanihan to Heal as One Act. Kasi dahil doon, of course, nag-provide yung gobyerno ng mga assistance like yung SAP, yung SBWS, yung DOLE Camp, nag-provide ng monetary. Kasi let's face it, malaki ang naging papel ng ating financial difficulty, financial struggle sa ating issue ng mental health. So yung mga support factors na provide, feeling ko hindi naman nagkukulang ang gobyerno. Yun nga lang sa panahon na to na COVID, like for example, establishment sa barangay level, paano natin i-establish na magkaroon ng parang consultation center or makapag-focus yung ating barangay health workers sa isang individual na may concern sa mental health kung ang kailangan nilang i-prioritize yung issue ng COVID, or hindi ka rin pupunta hindi ka rin lalabas ng bahay mo to avail of those services kasi syempre you'll fear na baka mahawa or anything. So but establishing those hotline, I believe malaking tulong na rin. And sabi mo nga may mga groups or associations of professionals na willing mag-render ng free services to help our fellow individuals na may pinagdadaanan.
Okay, thank you Attorney JB for that. Ayan, kasi medyo mahirap nga din na tayo, medyo mababang grassroots level given din yung conditions na tapos kung ano yung mga protocols na susundin but hopefully in the future kapag talagang na fully implement na natin yung law, talagang makikita na natin yung fruits niya mismo. Ayan. So yes, Attorney JB, will you like to add?
Nag-agree ako sa sinabi mo. Baby steps, but definitely mas feeling ko dahil sa sinisimulan na natin ngayon, hindi lang mga gobyerno, no, like us or private individuals, tumutulong tayo para magkaroon ng awareness at nagkakaroon na tayo ng mga avenue to address the concerns on mental health. I believe mas magiging pakinabang to sa lahat in the yung nga lang may certain priorities, no?
Yeah. Okay. So yung next question naman po natin, probably Miss Neri can answer this question, no? And this question came from Miss Celine Ann Rezonable. Sabi po niya, 2 weeks ago, ma'am, I have joined a webinar entitled Community-Based Drug Rehabilitation or Intervention for Minors. It shows that there is a high chance of relapse due to lack of social support, especially to the remote areas. As a concerned citizen, what can we do? Or probably, ano po kaya ang pwedeng magawa ng YWCA on this issue?
I'm not familiar yung area ni Miss Celine kung saan siya, no? Pero kung if ever, kanina during the video, you see some of the YWCA local association all over the country. You can also visit the YWCA website para sa mga local YWCA, and you can see the leaders and whom to link. As a concerned citizen, first, pwede niyong lapitan yung Sure City Social Welfare Office because they have these services for minors like that. Tapos, isa pa rin na pwede nyo rin munang lapitan ng yung barangay because some of the people in the remote areas, bago makarating sa kanilang municipality for the help of the social workers or some other professionals, babaybay ng napakahabang biyahe or ano. So I think the barangay is mandated to help their constituency. Napakalaki ng role nila sa mga ganyang to link them to government and private organizations. Of course, dahil namin mga hotlines, you can probably request a help. As during my volunteer work as part of the United Social Workers, there are calls that I receive, which I link them, like calls coming from Carmona, Cavite, but I'm not within Carmona area and I don't know some of the people in Carmona. I had to link it with a fellow social worker who is based in Bacoor, Cavite, who will link us to Carmona City Social Welfare Office. So, yung ganon na mga possibilities, pwede natin gawin as a concerned citizen. Kasi dito sa COVID, di ba, merong barangay response team muna. Napakahalaga po nun. So, as a concerned citizen, approach your barangay. Pag medyo nakita nyo parang wala, napakalawak ng sakop ng social media. You can just look for the Facebook account, YWCA, look for the Facebook account. And of course, ngayon, Amara and HealSpace. These are organizations that can help you. Just, you cannot do much, but you can link them to this organization.
Add ko rin lang po kasi yung CBDR yata na binabanggit kanina na Ms. Celine is under the USAID. Alam ko po kasi kapag if you're trained under the community-based drug rehabilitation program, so tinitrain, may specific na training din na pinagdadaanan with regards kung paano ba may establish yung community social support. Ayan. So baka pwedeng mas engage siya doon. Ayan. Para mas makakuha siya ng information. Ayan. Thank you very much po, Miss Neri, no? So, may mga ibang katanungan po dito pero inquiry siya regarding YWCA and nasasagot na naman po siya so far dito sa ating chat. Especially po yung pag-i-establish po ng mga local na YWCA na mga chapters or kung yung po yung tatawagin natin. Okay. Question pa po, this one po from the Cavite State University. Ito po very specific sa mental health because they are asking about coping styles or coping that could help those individuals challenged by the current situation. Okay. When it comes po sa coping styles, no, Iba-iba po yan, no? Pero let me enlighten everyone here po na pagdating sa coping, there are different aspects po that of our well-being that can be addressed, wherein we can do coping, no? At ito pong mga aspects na ito ng well-being natin makes up our mental health. Kanina po nabanggit yung definition ng mental health. So probably it's good to take note, no, ng mga areas ng well-being na ito at ano ba yung mga pwede nating gawin in order to address, no, yung mga areas na ito. Isa po sa mga aspects ng well-being is yung physical well-being natin. So how can we do, ano ba yung mga coping na pwede nating gawin? Syempre yung pagkain ng tama, pagtulog ng tama, pag-inom ng water, no, pag-exercise, vitamins, ayan. And then we have emotional well-being, no? So ano po yung mga coping styles na pwede nating gawin, no? Number 1, tuning in to your thoughts and feelings, no? Cultivating an optimistic attitude, no? Seeking and providing support, learning time management skills, and then practicing stress management techniques. That's for the emotional. For our intellectual well-being naman po, no, pwede tayong mag-take ng mga online classes, ayan, mag-take ng sari-saring mga courses online, matuto ng bagong language, talk and engage with people, ayan. For our social well-being naman, we can, one way of coping is by cultivating healthy and meaningful relationships, contributing to your community, yung mga pagvo-volunteer, ganyan, pagtulong sa kapwa. It's a form of social coping. And then, on the spiritual side naman po, you can explore your spirituality. You can do some meditation, no? You can be compassionate to yourself and to your others. And by seeing no opportunities for growth in the midst of challenges, those are ways of spiritual coping. And then, meron din po tayong environmental well-being. Ayan, marami sa atin mga plantita, no? So yung pagtatanim ng mga halaman could be a good coping for your environmental well-being. Pagre-reduce, pagre-reuse at pagre-recycle, and then renewing your relationship with earth. And then finally, we have occupational well-being. At dito po, may mga coping styles tayo na pwedeng gawin. Halimbawa, creating a vision for your future, no? Developing your skills and your talents that would be helpful to you, and then connecting with your bosses, connecting with your colleagues, ayan, and establishing healthy relationships with them. Ayan, so by looking into those different aspects of our well-being, and then by coping accordingly, no, dun sa mga aspeto na yun ng ating well-being, ayan, makakatulong po yun sa atin ngayong panahon ng pandemic. Ayan. So let's take note of those aspects. And Attorney JB, would you like
Sir
to
Dan?
add? Yes po.
Yes, i-add ko lang, no, since mostly na-explain mo naman, i-share ko lang rin siguro yung experience, no, sa coping. Kasi when this pandemic started around March, being HR, so we have 2,500 employees. So you can just imagine yung anxiety ko. Kasi parang anong naghihintay, lahat. Mahirap parang somehow may uncertainty. So what helped me during that time, no, and my team members as well, una, malaking bagay yung open communication with the people na, for example, sa office, like kami, colleagues, malaking bagay yung open communication. Second, it helps also, nag-create kami ng group na parang you can send a positive, quotes or prayer every day na somehow to jumpstart your day. Na sabi nga nila, minsan kasi kailangan parang kung gusto mo na i-uplift yung sarili mo, sometimes you just look in the mirror, smile at yourself. Minsan magugulat ka na lang, of course the image is smiling back at you, and somehow nakaka-feel good. Because malaking bagay din na to think of what are the things that we are, grateful for. So, yun yung mga, like, pagising mo, uy, buhay pa ako. Uy, walang COVID. Yung mga bagay na simple things. Name 3 things na ipapagpasalamat mo araw-araw, kahit paulit-ulit. Malaking bagay siya. And siguro, one, because we believe na sa why, ng healthy body, mind, and spirit. No? So, as apart from what you've said na yung eating well, matulog ng maayos, malaking bagay din yung parang detox sa social media. Yung I've practiced that for 3 days. Wala akong Facebook, wala akong Instagram, no Twitter, nothing at all. Even news, I didn't. Then even sa office, hindi rin ako nagpa-istorbo. Malaking bagay siya. Kasi parang you can find peace just by being silent. I-acknowledge mo rin ng sometimes, okay lang naman to be alone. May alone time ka, may me time ka. And for us na working, malaking iba Monday to Friday, nasa bahay ka. Make sure na you still do an activity na parang this is what I do every weekend. I do, for example, a K-drama. I don't do that pag weekdays. Pag weekend lang. To differentiate yung weekday sa weekend ko and pag workdays, to put a cap. Siguro like for example, up to 8 o'clock lang ako mag-entertain ng work questions. Beyond that, I'll focus naman sa sarili ko. And siguro, sometimes, wag na lang din natin, mahirap man, but yung overthinking as much as possible, kung sakali, parang kung pwedeng iwasan, no? Ako, what I did to cope up with that, alam niyo yung God Will Make a Way na song. Yung lyrics kasi niya, di ba, God will make a way when there seems to be no way. So feeling ko, this pandemic, as in I play that every day, or na-stress ako sa opisina, hindi kami masolusyonan, or may kailangan kaming pagdesisyonan, I play that. Somehow, nakaka-appease, nakakakalma. And mind you, from the start, so nung March, April, na I have anxiety regarding what's gonna happen. Wag kang mawawala ng pag-asa. Hope. Just always believe that something better will happen, that the condition will improve later on. And now sa company-wise, we're happy because hindi rin namin ina-expect that hindi kami everyone's functioning, marami kaming projects sa pipeline, the company is going strong, and until end of the quarter, secured kami for next year. And nawala lahat yung anxieties. Probably because kailangan mo lang din i-channel yung energy mo dun sa mga bagay na, sabi ko nga, you can, yung faith and all, just by being grateful. Little things, kahit anong bagay na pwede natin ipagpasalamat natin kasi malaking bagay siya. It sets the tone for the whole day, for the whole week. So, in a way, yung moods natin, yung how we tackle the whole day, nagiging bearable, nagiging somehow madali, no? So, yun.
Sorry, ayan, nakamute pala ako. Thank you, Attorney JB, no? Nabanggit mo na rin naman yung gratitude, no? Kasi sa psychology talaga na pagdating sa coping and recovery, napaka-essential ng gratitude. And dahil nabanggit mo na rin yon, mag-a-add na rin pa ako ng 2 pang essential elements, no, that could help in our coping. Number 1 is kindness to ourselves and to others. And number 3 is self-compassion. No? So ngayon pong panahon ng pandemic, wag nating masyadong ipipressure yung sarili natin, no? Or na maka-adjust or hindi or kung nahihirapan ka, no, wag natin masyadong ipipressure yung sarili natin, na lalong-lalo na kung makagawa ng isang napaka-importanting bagay, no. So kung nakakakita tayo sa social media ng mga taong sobrang productive ganyan, no, pero tayo parang hindi, we do not take it against ourselves, no, kasi yung way nila ng pag-a-adjust. So in a way dapat let's be kind to ourselves, let's be self-compassionate and allow ourselves to grow step by step, no, ngayong panahon ng pandemic. Ayan. So, Yun na po yung mga questions natin for this afternoon, no? Kasi may time constraints po tayo. We apologize if we're not able to answer all of your questions, pero doon po sa mga psych-related, I'll try to answer them by replying to your chat. Ayan. So again, thank you very much YWCA. Thank you very much Attorney JB and Miss Neri for helping me out sa ating question and answer, and we now go back to Miss Neri.
Thank you, Sir Dan. Thank you so much.
Thank you, Sir Dan.
Hindi niya ba napansin? Kamukha siya ni Alden Richards, no? Oo, di ba? Yun lang pag hindi pa naman natanggal ang mental concern niyo. Yung mga magaganda tinitingnan talaga. Anyway, so sabi nga ni Sir Dan, there are a lot of questions psych-related. We also received several questions from our Facebook Live related to psych question. On September 25, we will have our forum on Be Kind to Your Mind, Managing Anxiety and Taking Care of Mental Health. Nakapost na po sa chat room yung ating registration link. So yung iba po, doon natin i-throw yung mga questions. So with that, we would like to thank again Attorney JB Gayona and Professor Dan. And as a token of appreciation, we are presenting to you the certificate of appreciation. Mapa-flash ba sa screen? The YWCA of the Philippines and the National Youth Coordinating Council, NYCC in partnership with HealSpace Psychological Clinic and Amara Counseling Training Center presents this certificate of appreciation to Attorney J.D. Rosel G. Gayona for her invaluable contribution as resource person which led to the success of the YTalk series on understanding the Philippine mental health law. Part 2. Sa 30 po yung kasunod. So, hindi pa tapos si Attorney J.D. sa amin. Held on September 23, 2020 via Zoom, signed by Ms. Marla A. Baez, NYCC President, yours truly, and of course, signed by our National President, Mrs. Lilia Parinas. The same certificate of appreciation we are also giving to Professor Dan Paulo R. Yema. O diba, pati surname ni Sir Dan, matamis-tamis, Yema. Ang cute naman. Ngayon ko lang napansin ang gusto. Yun po, for his invaluable contribution as moderator which led to the success of the YTalk series. Thank you so much po. And of course, we have some tokens for you na siguro baka na-receive nyo na. We have tokens for you courtesy of the YWCA of the Philippines. We have the gift of faith, the Philippine YWCA story. You would see the inspiration coming from our women who have blazed the trail for the young women to have a safe space for them. And also some tokens for our speakers and moderators, which we hope you would like. So with that, I think the next item in our program is the closing remarks from our Vice President for Program and Membership, Dr. Early G. Datario.
Good afternoon to everyone. We express our heartfelt gratitude to Attorney Rosel Gayuma, the National Youth Coordinating Council, led by the President, Ms. Marla May Baez, the officers and members of YWCA Philippines, led by Ms. Leia Farinas, the staff of YWCA, led by Ma'am Nerissa Lena, and to all our participants. Thank you so much. From the new insights we gained from the topic of Attorney G.B. Rosel Gayuma on the Philippine mental health law, made us aware that the presence of mental health law plays a crucial role in community integration of persons with disorders, integration of mental health at primary health care, the provision of care of high quality, and the improvement of access to care at community level leads to better physical and mental health outcomes, better quality of life, increases accessibility, reduces associated stigma, and human rights abuse, prevents chronicity and probably ensures early detection and management of physical health comorbidities. Again, thank you very much to everyone.
Thank you, Dr. Early. Dr. Early is from the Gupan, Pangasinan. So with that, we're closing this activity, and thank you so much for those who participated. Looking forward sa pagdalo nyo po ulit sa Friday on about the mental health concern and part 2 of this understanding mental health law. Thank you so much. Hashtag yung ating pong Why Cares For You. So, ito po yung ating art card for September 25. Open na po yung ating registration then. And we have a lot of to thank. We will be flashing the different organizations who were able to make it and register for this forum. Thank you so much, Filipinas. Good afternoon.